Minister, it's quite extraordinary that we're having a debate here today about a recruitment embargo on many key frontline posts in healthcare, when you consider that we have nearly 1 million people on some form of health waiting list, when you consider the pressure many hospitals and emergency departments are under, and when you consider that for far too many people they are not getting the right care in the right place at the right time. And despite advancements which have been made in terms of the enhanced community care programme, we know many of the teams that need to be in place are not fully staffed. And yet we now have a recruitment freeze where 7,000 posts have just gone, vanished. We had the rug pulled from under many people who were offered jobs, went through a very lengthy recruitment process to be told that because no contracts were signed and the posts weren't approved, those posts are gone. We have nurses, we have doctors, we have healthcare assistants, and we have allied healthcare professionals who have emigrated to Australia, Canada, New Zealand, Britain and elsewhere, who've essentially been told now stay at home and don't stay in those countries, don't come home and work in the public system. And it's just extraordinary. It beggars belief that your government has put in place this type of recruitment embargo. And I have to put it to you that the reputational damage this causes for the health service, when we have such a real difficulty in recruiting and retaining staff and getting the numbers that we need in, I think is breathtaking, Minister. I also have to put it to you that this is a very chaotic way to fund the health service. It's again unprecedented that the head of the HSE will have to essentially write a national service plan for next year with a built-in deficit. Your government announced today a supplementary estimate for healthcare of €1 billion, €500 million short of what the head of the HSE has said is the deficit for this year. You know that it's going to be €1.5 billion. Only €1 billion has been given, and that difference now has to be carried over into next year, including the hole that's already there because you haven't properly funded the health service. So whatever mess that you created this year is going to be even worse, or this year is going to be even worse next year. And Minister, that's on you. The three asks that we had in our motion today, and they were very reasonable asks, were that you would end the recruitment embargo. That obviously is not going to happen, certainly not going to happen anytime soon. We asked you to bring forward revised estimates to properly fund the health service for 2023, and you bring forward revised estimates that leave the health service again short €500 million and lump that onto next year. And we asked you to reverse your disastrous decision to deliberately underfund the health service for next year, and you certainly haven't done that, because maybe I'm wrong, but that €1 billion that was announced today will not be recurring and go into the base. And yet we know all of that will have to be funded again next year. So you've actually made a complete mockery of how to fund the health services. And at the same time, as I said, 7,000 posts have now been scrapped. Vital frontline posts are now gone. Withdrawal of job offers from people who acted in good faith, and then consequences for patients, because what I am hearing, Minister, right across the health services, from chief officers to hospital managers, is they're making really difficult choices. There's confusion on the one hand as to what these memos actually mean, but many of them are struggling to understand what they do. They're continuing with job interviews, but no sense as to when those jobs can be offered and contracts signed. Some of them are saying that we may have to ignore elements of the memo because we simply can't do without the staff. Your own amendment goes on to talk about agency staff, and one of the objectives was to cut down on agency staff and management consultancy. You can't cut down on agency staff unless you have the replacement staff to go and work in the public system. And the head of the HSE talked about conversion of agency staff into permanent public servants working for the HSE. That now can't happen because of the recruitment embargo. And there's lots more in your amendment motion, Minister, which I will go through later. You talk about the reductions in the waiting lists, and 1% reduction in the waiting lists, 1% across all waiting lists. I'm not sure if you're looking for a pat on the back for a 1% reduction, but you certainly won't get it for me, and won't get it for those nearly 1 million people who are on community waiting lists, diagnostic waiting lists and acute hospital waiting lists. And, you know, and all the other elements of your amendment, Minister, particularly in relation to the enhanced community care piece. You talk about the care programme for older people. There's still no statutory home care scheme. Home care services will be affected by this recruitment embargo. Talk to any chief officer in community services and they'll tell you this. So you and your government have made a complete mess of how you funded the health service, and a direct consequence of that is this recruitment embargo that will impact on patient care. And that, unfortunately, Minister, is on you and on your government, and I commend the motion.
Minister, it's interesting to note that the government's line in response to this motion is that there is not in fact a recruitment freeze or an embargo. According to the amendments to our motion, it says recruitment is continuing for graduate nurses and doctors in training, that exemptions also apply in disability and a list of specified frontline and residential posts. But however, speaking to senior people in Kerry University Hospital, Kerry, they tell me they cannot recruit junior hospital doctors in non-training posts. They have sought clarification from the department and are none the wiser because they haven't received a reply. Despite the freeze being extended again, and I note that the government is refusing to rule out, or the HSE is refusing to rule out further extensions, it now covers such a broad variety of positions that the effects are beginning to tell inside in the hospital. Having spoken to other people, they tell me that physiotherapy and OT were already struggling and now are falling badly behind. For many who need physical rehab, this will likely mean irreversible damage or mean that they cannot rehab back towards an independent lifestyle. University Hospital Kerry was already 50 administrators short before this freeze, so scheduling of follow-up appointments is becoming increasingly difficult. Waiting lists are lengthening across the board, and perhaps most worryingly of all, results from lab tests are not being processed and returned to GPs in a timely manner, and there's no administration staff to follow up on tests of concern. Surgery, orthopaedics and rheumatology are also affected, according to people that I spoke to. Winter and the flu season is coming, and there has also been some COVID outbreaks. The influence of the flu has already been seen within paediatrics, and management positions, of course, cannot be completed until the RHAs are commenced in the new year. Outside of hospital settings, things do not look much better. The government's stance is that the disability sector remains unaffected, or they are exploiting the fact that some care roles inevitably have a higher turnover, meaning recruitment must continue to claim that there is no embargo. I spoke to one worker in this sector who told me a contract offered was rescinded, and another healthcare worker was verbally offered a role. This is rescinded also. Investments that should have been made years ago and should have been enforced were left on a shelf, and it's the sick and most vulnerable that will suffer.
The recruitment embargo put in place by the CEO of the HSE has been triggered directly by this government's mismanagement of the health budget. Job offers have been retracted, recruitment has been frozen for thousands of essential frontline posts. More than 7,000 critical posts have been scrapped. And as we head into an extremely difficult winter, the government has decided to underfund the health service. And basically this will mean no additional experienced nurses and healthcare assistants in spite of hundreds of patients on trolleys and hundreds of thousands on waiting lists. No additional psychologists for CAMS, despite the fact the number of children on waiting lists has doubled under this government's watch. No additional home care workers, in spite of the fact that 5,000 older people are waiting for home support. No additional therapists for specialist discharge teams. No additional radiographers or clerical staff for radiology departments, despite 250,000 people on diagnostic waiting lists, and no additional porters or hygienists or cleaners to keep patients safe from infections. And further investment is required in enhanced community care reforms to deliver early intervention and integrated care for older people, chronic disease management, local rehabilitation services. And all of these are urgently needed to take pressure off our hospitals and deliver the right care in the right place at the right time, but these will now not take place. And the recruitment freeze has caused extreme reputational damage to this health service. What about all the Irish nurses working abroad who want to come home? What about all the healthcare professionals who are graduating this year and hoping to start their careers here at home in Ireland? What the government has told them essentially is to leave, go to Australia, go to Canada, go to Britain, go to New Zealand. And what you've told these and other countries is, come right ahead and take our essential workers. What a message to send at a time of great crisis in our health service. It's obvious from the budget that your government is throwing in the towel on health. You've ensured that tens of thousands of patients and staff who will be condemned to extreme risks in hospitals this winter. Gael promised to end the scandal of patients on trolleys 16 years ago. But under successive governments with Gael at the helm, it has only gotten worse. The Government must reverse its disastrous decision to underfund the health service and lift the recruitment embargo. And if it's incapable of doing this, it should stand aside for a government that...
Minister, you're going to be in Letterkenny on Friday and you will meet with the representatives of the GPs and consultants who have expressed grave concern about our major acute hospital in the county. This is an important meeting. I'm urging you to listen to what they have to say, to understand that what lies at the heart of the crisis in our hospital is years of systematic underfunding. In a recent letter to you from almost 30 consultants in Letterkenny Hospital, they estimate that the underinvestment amounts to, right now, €45 million. It's about 25% less than the hospital should have. That also means that we don't have the number of consultants, junior doctors, nurses, beds right across the spectrum. And it is absolutely unthinkable, with all of that said and that challenge that you're going to face on Friday, that you would have a freeze on recruitment, not just in Letterkenny University Hospital, but anywhere in the health services across Donegal. Because, as you well know, if you have a recruitment freeze in community hospitals, in community care, all of that has a knock-on impact in the crisis at the emergency department. So I just want to urge you to act on the issues that they raise, to have a plan where the senior management of Letterkenny Hospital and the Sale to Hospital Group meet with the GP representatives, the consultant representatives and the TDs and councillors in the HSE forum on a regular basis, giving us updates and actions. But fundamentally, Minister, we need you to accept that it is an absolute fact, an incontrovertible fact, that there's been systematic underfunding, neglect of that hospital compared to other hospitals. It's clear that's the case. And to turn that around and to address the issues raised here. You know, you cannot defund the health service. You cannot have a recruitment freeze at a time of crisis. But my God, you cannot do it in Donegal.
In life, two of the most important things are health and housing, and both areas seem to be in perpetual crisis here. Indeed, most of your actions actually seem to be making matters worse for people. A recruitment freeze in the health service at a time when the system is bursting at the seams is just simply incomprehensible. And you'd think that it would be a cost-saving exercise, but is it? So many within the HSE want to move away from agency staff, but this recruitment ban is doing the exact opposite. And not to mention, Minister, the young people who are being treated as an afterthought by this government. This government's idea of workforce planning seems to be getting graduates on a plane to Australia as quickly as possible. And let me tell you, Minister, of the story of one young woman who contacted me. She's a speech and language therapist who was recently offered her dream job in a rehab hospital. Due to the demand, she started the job in a temporary capacity through an agency while waiting for the contract. And as this can take months in the HSE, she relocated to Dublin to do so, and then the job offer was withdrawn. And as she had started through the agency before the freeze, she was allowed to continue to work, albeit with no job security. And this situation is now that the HSE are paying 30% more for her through the agency than if they had been able to honour the contract. And as she said to me, nobody wins in this situation. Then, Minister, there are recent healthcare graduates who are thinking, does this country not actually want me? And I was contacted by one woman about podiatry graduates in Galway who were holding out for HSE jobs. They'd done their interviews, were told there would be offers becoming available because we are crying out for podiatrists in our more rural areas. They are now in limbo, scrambling to find private clinic jobs. And as that woman said to me, I think the freeze will cause the brain drain of healthcare students. Ara ní is a cíl be go nachhfuil mujinan dína a arcu dína óga atá cálathe I réimse leathan is sa chóras license seo. Atá gira ober an seo an air, and atá gira ober in gáile I gceantracha iarghúlta fud fad na tíre nachhfuil an mar eol an bach ostu an seo. An bach a chuir tusa isteach a ara. Cahamud fís a bheith an gon tíir seo. Cahamud breanú an tauchaí. Cahamud breanú tauchaí na dtína óga. Tauchaí na dtína óga sin atá díreach críochnaí lena good staidir. Atá gír fannacht an seo, atá gír bheith lonithe an seo. Tasíon fosío chomh siúd.
Minister, the recruitment ban puts lives of patients at risk, and that's as simple as I can say it. The embargo on recruitment makes the job of our dedicated health care professionals more difficult and more stressful, as if working in the emergency department at UHL wasn't stressful enough. The embargo on recruitment prolongs the wait time for those on waiting lists and ensures that the numbers being treated on hospital trolleys and in our hospital corridors continue to rise. This is an absolute failure. This year to date at Limerick University Hospital Limerick, 19,153 people have already been treated on trolleys. We will exceed 20,000 people this year, which is an utter disgrace. The people of Limerick and the Midwest have been utterly abandoned by this and previous governments. We have already surpassed last year's record of 18,012. I stress the word people. Those lying on trolleys, devoid of privacy, and are people who have been assessed, deemed in need of a bed at a hospital, yet no bed is available for them. Winter is here, and without adequate staffing and capacity numbers, it will be a lethal winter for some of our patients. It is worth mentioning that what Professor Ian Higginson of the Royal College of Emergency Medicine said: for every 2 patients who wait for more than 6 hours, there is 1 associated death. The CEO of the Health Service noted that the embargo on recruitment will create difficulties, he said, at a time of enormous increased demand. Yet you opt to remain to the recruitment embargo, you opt to underfund the health service, and you opt not to fill thousands of essential healthcare posts. The lack of action has sent a clear message. It is a message of capitulation from this government. It is the white flag being raised, and the message to our healthcare professionals is the message that says, we are abandoning you. The freeze and underfunding has a real impact in our hospitals. At UHL, there is a huge shortage of cleaning attendants and catering attendants. Those who work at porters are having to do additional time all the time. The recruitment freeze has compounded this. UHL is now 6 months without an attendant in the X-ray department. The person who was fulfilling this role retired and still hasn't been replaced. That not only impacts the X-ray department, but it has a knock-on effect on delivery of diagnostic services and inpatients at the hospital. So what we need to do is immediately put an end to the recruitment embargo on essential posts and a reversal of your disastrous decision to underfund the health service for 2024.
And this debate tonight is just another example of why this country needs to get Fianna Fáil and Gael out of government and out of government fast. Because the deliberate underfunding of the health service, and that is exactly what these parties have done, the deliberate underfunding of the health service makes no sense. It is bad for patients, it is bad for staff, it will cost us more in the long term. And we know the consequences of that because the health professionals are telling us day in, day out. Delayed diagnosis, delayed treatment means worse outcomes for patients. And let's call it what it is, Minister. It means people will die as a result of government decisions to deliberately underfund our health service. And you do that at a time with your eyes wide open, knowing that our health system is creaking, knowing that our health system is under a massive pressure in terms of resources, in terms of capacity, knowing that our waiting lists have never been longer, knowing that people are lying in corridors and in chairs and on trolleys for hours and hours on end, and indeed in some cases days. And what do we have? We have a minister who comes before us and tells us that they are deliberately going to underfund the health service, as we've heard from the head of the HSE, as we've heard from the General Secretary of your own department. And what this means for patients, it means more pain, it means more misery, it means more delays. It means in my own county of Donegal and Letterkenny University Hospital that it means a further difficult time that they're facing into. Job offers already withdrawn. Recruitment has been stopped across thousands of frontline services posts right across the state. In the first 10 months of this year, Minister, there has been 4,633 patients were admitted to Letterkenny University Hospital without access to a bed. 4,633 patients. That's a 400% increase in the last 10 years. 4,500 people can't get a bed in Letterkenny Hospital in the first 10 months. And what do? You deliberately underfund the health service, forcing the HSE to introduce a recruitment embargo. What it means is that the 2 radiologists that we have will have to continue just to put up with, because there's 5 posts unfilled there, and then now there's a recruitment embargo. 1 endocrinologist in terms of diabetes, the least in the state. What happens? Recruitment embargo. We've lost our dermatology service in Letterkenny. No chance of getting it back because you've ensured there's a recruitment embargo. You have thrown in the towel on health. You've given up on the health service. You've given up on the people who rely on it. It's about time now that finally the people get their chance to give up on this government and put you out of office.
Last Friday, the head of our National Screening Service, Fianna Murphy, posted the following words: "Amazing to be part of this. I never thought when I started in healthcare a long time ago that it would be possible to eliminate a cancer, especially one that was increasing. Now we will see it in our lifetime. Remarkable." Kim, a patient advocate, described how much it meant to her to be at the event, having herself had cervical cancer. She said, "To see the progress that's being made in eliminating this cruel disease is really something." On Friday morning last, clinicians and patient advocates met to launch our roadmap to eliminate cervical cancer. We're only the 4th country in the world to announce such an ambitious target. The launch is so significant and it is so positive, and yet I didn't see a single comment from senior figures in Sinn Féin to mark this momentous day. In contrast, the Sinn Féin motion talks about throwing in the towel. We've just heard Deputy Doherty talk about throwing in the towel. Throwing in the towel is collapsing the Northern Ireland Assembly in the face of Brexit nearly 7 years ago. So how has that worked out for patients in Northern Ireland under Sinn Féin? Hospital waiting lists in the south used to be longer than they are in Northern Ireland, but not anymore. In fact, the lists in the south are now half what they are in Northern Ireland. And for patients waiting in the south for over a year, the list is 10 times shorter in the south than it is in the north. That's what throwing in the towel means. It means walking away from the people of Northern Ireland when they needed leadership on the economy and on public services like healthcare. That's what throwing in the towel looks like, and that's what throwing in the towel does. So let's go back to last Friday. After we launched the plan for the elimination of cervical cancer, I visited the new outpatient building for the Rotunda Maternity Hospital. The building is just off O'Connell Street. It's a €45 million investment by this government in a state-of-the-art women and infants healthcare facility. It's going to transform care for women and children for decades to come. Again, not a single word from Sinn Féin. Instead, Sinn Féin's motion tonight is describing things as disastrous. To read the Sinn Féin motion and to listen to some of the contributions, you would be forgiven for thinking that there isn't a doctor or a nurse working in Ireland today, that they've all left the country and that nobody abroad wants to come here. The truth, of course, is very different to that. The truth is that babies born today will reach adulthood in Ireland where we expect to have eliminated cervical cancer because we have been hiring more doctors, more nurses, more health and social care professionals than ever before. We're in a position to achieve this ambitious target thanks to the incredible dedication of those working in our health service and the support of the patient groups. The truth is that we can provide new services for women and infants from new facilities because we have expanded the workforce. The truth is that the waiting lists fell last year for the first time since 2015, and they are on target to fall again this year because of record levels of recruitment for 3 years in a row. Since 2019, we've increased the number of doctors working in the HSE by more than 2,500. The number of consultants in permanent posts has gone up from 2,600 to 3,500. We've increased the number of nurses and midwives by nearly 7,000. We've increased the number of health and social care professionals by nearly 3,500. And we've increased the number of non-clinical staff by more than 10,000. So deputies here, very understandably, have spoken about their local hospitals: Letterkenny, Limerick, Kerry and others. Those hospitals have never, ever had the level of investment that they've had over the last 3 years. They have never had increases in their workforce like they've had over the last 3 years. And next year, we plan on increasing the workforce by several thousand more. More nurses to roll out safe staffing, more clinicians to open more hospital beds, more intensive care beds, more community beds, more professional staff to speed up the pace at which we can build new beds, new primary care centres, new hospitals, more digital professionals to help us roll out digital health services to patients. In fact, the HSE has been hiring at such a pace that they reached their full hiring targets early this year. So, of course, having filled the posts that they are funded to fill, which is the third record year of recruitment in a row, at that point they stopped hiring. That's how it works in every school, every Garda station, every local authority, every business. You have money to hire this many people. When you have hired that many people, you can't hire more people. That's how it works. Yet the motion before us here tonight describes this approach as disastrous. Incredibly, the motion decries the mismanagement of the health budget, presumably a reference to the HSE spending more money than it was funded for because they treated a record number of patients. The motion decries the mismanagement of the health budget and then goes on to demand that the same HSE hire into a bunch of posts that they're not funded for. You can't have it both ways, deputies. Which is it going to be? Do you want proper financial management, or do you want the HSE to just hire into thousands of posts for which it isn't funded for? When I speak with health ministers around the world, many of them tell me that their biggest challenge is an inability to hire doctors, to hire nurses. In Ireland, by contrast, we are hiring at record levels, and we have exceeded the already ambitious targets for this year. Where I agree with the deputies is that there is absolutely no question but that many of the jobs in our healthcare service are very intense jobs. They are tough jobs, they are difficult jobs. Working in emergency departments, working in intensive care wards, working in complex surgery, to name but a few. There is also no question but that we must all strive every day to do better and better for patients and do better and better for our fantastic healthcare professionals. That's why we set up the NCHD task force. That's why we hired a chief health and social care professional. That's why we're rolling out safe staffing through next year. That's why we're continuing to invest in advanced practice. That's why we're investing in new primary care centres and new bed blocks and new hospitals. That's why we've been hiring at record rates for the past 3 years, and that's why we're expanding healthcare college places. It is also true that the vast majority of healthcare professionals I speak with talk with passion about their work and about their patients. They talk with pride about their hospitals or about their community organisations. It's true that the vast majority of qualifying healthcare professionals in Ireland choose to stay and work in Ireland. And some do go abroad, as is normal and natural and healthy. And it is also true that the majority of those who qualify here and choose to go abroad in time choose to come back home and to work here. We are very fortunate in Ireland to have such high-quality healthcare training and education. We are very fortunate that so many internationally trained healthcare professionals choose to work in Ireland. They've been doing that for many years. They'll continue to do that next year, whilst we expand again by several thousand the healthcare workforce. This government will continue to grow our healthcare workforce. We will continue to invest in our healthcare workforce, and we will continue to support in every way we can our fantastic healthcare professionals to be the very best professionals that they can be. Gur Magat.
Sinn Féin, to Johnny Deputy, you're eating into you're eating into your colleague's time. Deputy Johnny Quirk, uninterrupted. Uninterrupted.
Thank you. Minister, after speaking to several healthcare professionals, the recruitment freeze is having a hugely negative effect on healthcare professionals. It is cornering them into an environment where burnouts in staff have become a frequent occurrence, and the thoughts of emigrating to Australia, New Zealand, Canada and so on is not given a second thought. Organisations like the Marisa Foundation, which provides care for individuals with disabilities, are also on the brink of service shutdown due to the recruitment embargo. The struggle to find and retain staff is real, and the embargo has only made the situation worse. The decision to withdraw job offers to qualified candidates has left many wondering about their futures in Ireland as trained healthcare professionals. Too often individuals with disabilities become the casualties of the government's inadequate health budgets. Without sufficient staffing levels and a steady influx of new healthcare professionals to fill vacant positions, many of these individuals are unable to live meaningful lives within their own communities. In my home county of Meath, the underfunding of health services by the current and past governments had significant consequences. Navan Hospital serves as an example, with years of underfunding by successive governments leading to the bypassing of its A&E department. Hospitals and healthcare organisations should be adequately funded to recruit staff directly instead of using agency staff, which costs more money in the long run. The impact of the embargo is being felt by both patients and staff. Urgent care is prioritised over routine care, resulting in increased waiting times and a strain on scheduled procedures. This could lead to the deterioration of patients' conditions. The burden placed upon hospital management and consultants is immense. They are forced to make difficult decisions, choosing between urgent and routine care. Prioritising urgent care may seem like a logical choice, but we must remember that routine care is equally important. It is a delicate balance that should not be compromised due to staffing shortages. Also affecting nurses, non-training doctors, health, social care professionals. And it's not just doctors and nurses that's affected, Minister. The embargo on administration staff. Look at the work they do, from answering the phone, organising patient clinics, organising medical records, organising bloods, schedule appointments, registering appointments, pay wages, purchasing supplies, paying supplies, and then you have cleaners, patients and parking. This embargo will lead to more risk for patients and lead to longer waiting lists. Thank you.
Minister, I cannot believe the response that you have given this evening. I really thought that you were going to come in here, you were going to listen to what was being said, and you were going to commit to bring forward a revised estimate in relation to health, because you would have seen by now the disastrous decisions that were made in the budget, but you didn't. Instead of that, you came in here to paint a picture that is not the reality on the ground. And the reason I know that, as late as yesterday, I and our party health spokesperson, David Cullinan, visited our own hospital in Mayo University Hospital to listen to the nurses and to listen to people working in the hospital and to listen to management as well. Now, I'm glad that you talk to people all over the world, Minister, I really am. But you need to get down there and talk to people about the reality that they're facing. That hospital alone is operating at 125% capacity. Does that not alarm you? 125%. With exhausted staff, they haven't even had time to recover since COVID-19 and all that was expected of them then. And that is right across the system, right across, from the people working in labs to the people working in the front line and ED and everywhere else. They haven't had time to recover. And we're asking them to continue on working in an environment where it's 125% capacity. You don't think it's a problem that 880,000 patients are waiting for treatment? You don't think that that's a problem? Thousands of them waiting in Mayo alone for that. Well, I'm shocked at the answer that you've given this evening. Thank you.
Minister, the recent announcement by the CEO of the HSE will have an immediate and very serious repercussions on our public health services. Up to 7,000 frontline posts will be ousted and withdrawn from an already overstretched workforce. A workforce facing the real possibility of not being able to provide necessary vital care to communities across the entire country, including Wexford. It was obvious from the budget 2024 that the health budget was way off the mark. Minister, the fallout of this is on your department and the Cabinet's decision to underfund the health service in budget 2024. Sinn Féin forewarned the government of the consequences of this undertaking would cause to vital services and patients alike. The list of services that will be affected on your decision is too great to name them all, but I will mention a few. There will be no additional psychology for CAMS. There are approximately 120 posts unfilled, even though the waiting list has doubled. What about our elderly people who are in dire need of some support services? We already have 5,000 people on waiting lists, including over 510 individuals from County Wexford awaiting home care supports. We have another 250,000 people on diagnostic waiting lists. Again, what about the hundreds of patients on trolleys? 562 today, plus the tens of thousands on waiting lists because there is already a shortage of experienced nurses and healthcare assistants. Yet, you were going ahead with an embargo on recruitment and retention. Your announcement of an extra £1 billion from the Cabinet this morning is very welcome. This may help this year, but what about 2024? Minister, will there be an embargo in place for 2024? This government has made many promises that is going to fix the health services. Yet, how can you explain placing an embargo on 7,000 frontline posts that will help? Minister, as a Wexford TD, it saddens me to see so many of our young professionals from Wexford and beyond forced to leave our shores from Australia, New Zealand, Canada or Britain to find employment. I'm sure their families felt heartbroken and let down as they said goodbye to them. We need to bring our highly trained health service staff back home to help deliver the health services the people of Wexford and Ireland need and deserve. We would ask that the embargo be lifted and a restoration of jobs that were promised in good faith to be restored.
Deputy Morris Quinlan. No. Deputy. I beg your pardon. No, I'm looking at the wrong. Sorry, I beg your pardon. Deputy Ellis Gumalish. It's the next list. No. Deputy Brian Stanley.
The argument on recruitment has been described by the Irish Nurses and Midwives organisation as a kick in the teeth. The government's decision in the budget to underfund our health services now means that 7,000 essential posts have been scrapped, placing a huge burden of work on struggling staff. And as frontline staff minister, if you take across Laois Offaly, we have chronic understaffing of posts in vital services and supports. In child and disability services, in the child and disability network teams, 42% of all posts are vacant in Laois, while in Offaly 35% of posts are vacant. In CH08, the area that covers the Midlands, Louth and Meath, we have huge vacancies across the board. 32% in speech and language, 36% in occupational therapy, 41% in psychologists and 55% in dietitians. That's just a flavour of what's happening there in frontline posts. Figures that we received at the Public Accounts Committee add further detail to the picture of what's going on in CH08. 10 posts in medical are vacant, 30 in nursing and midwifery, 31 in health and social care, 15 in patient and client care, 40 in community services. Yet the same document outlines that we have 34 more posts than we need in management. That's 34 additional staff in management and administration, according to the HSE's own data. The decision to underfund frontline services will create difficulty and is already doing that, and it will put healthcare of patients at risk. There is no doubt about that. Job offers to health service workers have been withdrawn, vacant post advertisements have been removed from websites, and you've sent a message to those healthcare workers working abroad: stay where you are, don't come home. In fact, healthcare workers that we have trained in our system, we're training them to leave to work in other systems. Our motion, what we want here, is the recruitment embargo lifted. We want a properly funded health service and an urgent revised estimate for 2024, which you actually look for extra money yourself, Minister. You know, we know that it's needed. Frontline services are falling down. There's gaps there that need to be filled.
Ministers, this government's mismanagement of the health budget is no secret, but mismanagement on such a scale to force the HSE CEO to escalate the embargo on recruitment, withdraw job offers and scrap more than 7,000 essential frontline posts is beyond belief. This is beyond disastrous when the HSE is already facing unprecedented staff shortages in all sectors, affecting its ability level of services required. The health budget should at the very least maintain existing level of services and provide for any new measures. It sounds okay, but what if the existing levels of service being maintained are bed shortages in hospital, chronic staff and shortages, existing frontline doctors and nurses run ragged, people lying on trolleys in overcrowded emergency departments. And I speak from this. Recently I was in James's, and the staff in St James's are excellent, but you'd want to go to the A&E and see what it's like. It's hemorrhaging staff because they simply can't work there. It's that bad at this point. And I have spoken to them at length around this. Children waiting for years for life-changing surgery. Hundreds and thousands on long waiting lists for urgent treatments. Mental health services in complete disarray. No staff to deliver home care packages for our elderly. No jobs for our graduate nurses and doctors. No frontline porters or cleaners. With your government's budget, ministers, the HSE is not even running to stand still. Your government's decisions have sent them running backwards. Service levels are not being maintained or even reached. They are being decimated. In my own constituency of Kildare South, there are existing levels already fall far below what is desperately needed. Not enough public health service nurses to reach vulnerable rural patients. Frail and sick older people who desperately need home care packages won't be delivered because there's no home care workers. 100 posts now not being delivered in Naas Hospital because of the embargo. Gael and Fianna Fáil have had 13 years between you to fix this health service, and still we are facing into this catastrophe. Gonera Shiv Golea. This government's continued failures has repeatedly put people's lives at risk. Enough is enough. You need to lift the embargo and properly fund the health service. And Minister, the level of service at the minute is so bad, people are actually going to die. We need to stand up here and say that. And I'm going to finish with this, Cahill. I recently asked PQ around cancer diagnosis and cancer treatment in patients, and I was told it had improved. It was down to 57 weeks now. That's down 14 weeks on last year. Are we having a laugh here? Thank you.
Deputy Louisa Riley.
Thank you, Cahill. Ministers, I remember the last moratorium, the last time Fianna Fáil were in government in 2009. Was a full public service recruitment moratorium, 07 it was, for the health service. The impact of that is still being felt today. The HSE did not recover from that, and the evidence of that is all around us. The evidence of that is in your lengthy waiting lists. The evidence of that is in the people who get left in your health service on trolleys overnight, on chairs, in corridors, or wherever they can be put. That speaks to a staff shortage. That is the issue there. Not enough capacity, not enough staff. And I listened with interest to the Minister's speech, and he has, as they say in the west of Ireland, a great welcome for himself. And if I cut through the bits where he's throwing bouquets at himself, and look, he refers to the target, the setting of a target. It's not quite an achievement, it's the setting of a target, and it's absolutely laudable. I 100% agree that the elimination of cervical cancer is absolutely laudable. However, we need to get a bit of perspective. There are 650 women diagnosed with cervical cancer on an annual basis. That's about the same number as spend on average on a trolley for one night. So it's a laudable aim, absolutely, but perspective is also important. Minister, you said that you have no intention to cut services. Sure, you said the same. Fianna Fáil said the same in 2007, 2008, 2009, and services were cut and cut to the bone. A recruitment moratorium, a pause, a freeze, or whatever words you want to put on it, is a blunt instrument. It is no way to deliver decent healthcare. It is no way to treat those men and women who are working day in, day out, night in, night out to try to deliver a healthcare service. You have thrown in the towel on health, and the evidence of that is in your recruitment moratorium. Recruitment freezes don't work. Recruitment freezes hurt patients. Recruitment freezes are what governments preside over when they have given up, thrown in the towel. You have underfunded the health service. You are compounding that with a recruitment freeze, and the people who will suffer are the patients and the workers in our health service. Shame on you.
Every single patient, every single healthcare worker in this state should watch back the Minister's response to our motion here today. And what they will see in the Minister's response is he spent most of his time attacking Sinn Féin. He points to the north, which obviously ministers do every time they're under pressure. But what the Minister fails, obviously, to point out, in the last 2 elections in the North, Sinn Féin increased its vote to record levels. And that should tell the ministers across where the people of the North stand in relation to Sinn Féin. But of course, it's all a smokescreen. He then goes on to decry the fact that we described his recruitment embargo and the deliberate underfunding of the health service as disastrous. Now, I don't know what words the Minister for Health wanted Sinn Féin and I to take when it comes to a recruitment embargo and a deliberate underfunding of the health service and inadequate funding of the health service as described by the current head of the HSE. Do the ministers believe that we should welcome it? As an opposition party, that we should welcome the fact that we now have a recruitment pause and embargo in place in the health service? Do the ministers see it as a good thing that the rug was pulled from under so many workers who were actually offered jobs? And what's interesting in what Minister Butler said, the memo is actually very clear, the second memo. It says all job offers which have been made, unless contracts were signed and unless the posts have been approved, are gone. Now, if there's been a change, I would like to see that, but that's not what's in the memo. In relation to disability services, we were getting feedback from chief officers in disability services and in community health organisations, and they were unclear. So I contacted the head of the HSE. He acknowledged that in the list that was published in relation to disability, CDNTs weren't on it, and he had to issue a further list. And that's because there is confusion and chaos because of what's happened here. All of this is a crisis-driven response to a very deliberate underfunding of the health service. Now, I was in a number of hospitals over the last number of weeks, in Kilkenny, in Mayo, and I'll be in Galway next week. I've met hospital management and I've also met staff. And I can tell you that if they were listening to the Minister's response, they would be very, very angry, because they know that everybody in this House welcomes and celebrates the work that our frontline healthcare workers do. They don't like when ministers try and hide behind their good work and their hard work, but they'll equally tell me that they're fatigued. They went through a very difficult time with COVID. When we came out of COVID, and most of us got back to what we do, and we can live different lives because of the improvements. They're still living in very difficult circumstances and working in very difficult circumstances with emergency departments, which we know are still overstretched, patients on trolleys in record numbers, and really difficult challenges in our acute hospitals, but also in primary care. I spoke to the Chief Officer of Community Services in the South East, who used to be the manager of the hospital in Waterford, and I spoke to her about the recruitment embargo. And she said to me that it makes no sense, because she has now services which are very stretched in relation to mental health and in relation to home support services. She isn't able to replace staff, so there's no one in and one out. She has vacancies that she can't fill. She talked about a whole range of areas in primary care services for physiotherapy, speech and language therapy, vacant posts which she can't fill. Home care support services that she now cannot fill at a time when we need to make sure that older people are cared for in the community and in the home. She, like me, recognises the good work that was done with the enhanced community care model, as all chief officers do. The ICPOC teams, the chronic disease management teams, but a lot of them are not fully staffed. None of those positions can now be filled because of this recruitment embargo. So I just want to say to Minister Donnelly, who's now gone, his speech doesn't cut the mustard, and he can attack Sinn Féin all he likes in the real world out there. And I really hope in the course of an election campaign he takes the same approach in that campaign that he took here tonight, because I think people will give him his answer very, very quickly. What people want are decent health services. What people want are investment in our health services. And the very fact that we're debating here tonight a recruitment freeze and embargo in healthcare, and the message it sends out to those who've left and emigrated and those who are going through our training colleges, and the message it sends to patients when we have so many on trolleys and 1 million people on health waiting lists, is entirely the wrong message. And if the Minister for Health doesn't see that, he's in the wrong job and he needs to go. And we need a new government and a Minister for Health that actually knows what to do in terms of how to fix the problems in our health service.